Hi there. In the study group we started recently, one of my students asked me about this scenario. It says that a teenager has come to you with diabetic ketoacidosis. He has got compliance issues with insulin. He is a shy boy. He is teased by his friends because he uses injections. How can we psych approach, ask about knowledge of diabetes mellitus and insulin, and explain diabetes mellitus risks and consequences. This is not a proper scenario that will be framed in the exam, but it covers most of the important things because this one is a very lengthy scenario to cover. But if you are thorough, you can probably cover everything. I would like to thank the doctor who actually has written some proper points there. But unfortunately, in the exam, it's a time based exam. In 8 minutes, you can't cover all these important things. So, we need to be very careful when you're taking history because if you're wasting too much time on unnecessary things, then you will probably not finish the station and most probably fail the station. Okay, so if I am reading this scenario outside the room, this is how I will be thinking. Okay, teenager comes with diabetic ketoacidosis. Anytime it's a teenager scenario, you have to be very careful. Okay, so extremes of age is one thing where I will be very careful. For example, if it's a child or if it's an elderly person or if it's a teenager, you have to be very careful whenever you read the scenario starting with these age groups because there are lots of risk factors for each of this age group and you have to be very careful because these people are highly vulnerable. Okay, so has got has come to you with diabetic ketoacidosis, so obviously it's an emergency scenario. So this is how I read the scenario outside the room. Okay, so teenager with diabetic ketoacidosis, I will think, okay, most likely I will have to admit this child, but what is the issue here? Okay, admitting is not an issue. You have to treat the cause for this problem. If you're not treating the cause, simply admitting him and sending him home, he will come back in 2 days time with the same problem. So that's the reason this scenario is framed because they want you to treat the cause, not treating the symptom. Okay, so he has got non-compliance with insulin. Okay, so he is a shy boy and he is teased by friends for injection. Obviously, if it's a teenager, they will be teased a lot. So you have to think about bullying. Okay, so many people will probably think that this is a most likely case of diabetic ketoacidosis management. But one thing you have to be very careful. This could be a suicidal patient presenting with a diabetic ketoacidosis. Okay, this patient, who has got this diabetes problem, he might be bullied very badly by his friends. Okay, so he might be suicidal because teenagers are at high risk of suicides. So that is one thing I will be thinking. Okay, I have to ask about depression, I have to ask about suicide. Yes, he has come to the hospital with ketoacidosis, but my red flag is suicide. Okay, so how can we approach? Obviously, you need to first build rapport with the patient. Any teenager scenario, first thing you do is confidentiality. Okay, so you have to tell the patient, look, John, or whatever the patient name is, say, John, I am Dr. Talari. I am here to help you. Anything we discuss is going to be confidential. Okay, so you have to talk about confidentiality at the first place. Okay, so this is how I start my teenager scenarios. I will start with my confidentiality. I will say, I'm Dr. Talari, pleased to meet you, John. I'm one of the treating doctors here. I'm here to help you. Okay, you're building a bit of rapport with the patient. And you will tell the patient, John, anything you tell me is confidential. Only you, me, and the treating doctor will know about what all you tell me. Okay, so whatever it is, English, it doesn't matter. So that's the bottom line. You have to tell him that anything he tells you is confidential. That's the main thing. When you tell this to teenager, he will then open up and give you further history. Okay, so ask about knowledge of diabetes mellitus and insulin. So you can ask these things. These are not a big thing. And explain diabetes mellitus risks and consequences. Anyone will do that. because you know how to ask history about diabetes mellitus, you know how to ask about insulin, you know the complications of diabetes, you know the risks and consequences. But the main thing here in this scenario is you identifying that this patient could be suicidal. Many doctors might fail this scenario because they are only looking at the diabetic ketoacidosis, and they are probably looking at, explaining what diabetes is, what insulin is, how you take insulin, all these things. That's not what the examiner is looking for. The examiner is looking whether you are actually picking up the red flag, which is suicidality in this patient who is teased by his friends. Okay, that's the most important thing. I think that's what you need to look at. That's the approach, that's the psychology, that's the thinking behind this scenario. Okay, so confidentiality, start with open-ended questions. Ask him, try to build rapport with this teenager. Don't start by bombarding this patient saying, are you taking insulin? What time do you take? When was the last time you took it? These are not important. Try to build rapport with this patient first. Then you need to ask about HEADS. HEADS is something, you need to ask in every teenager scenario. HEAD stands for H is home and environment, E stands for education and employment, A stands for activities, D stands for drugs, S stands for sexuality, S stands for suicide or depression. Okay, so there is a mnemonic called HEADSS. This is very important. This is what I will start with. I will say, John, tell me about before I ask anything about insulin, I will try to build a bit of rapport with this patient. So I'll talk about confidentiality. Then I will talk about, tell me about your home situation, John. Okay, so whom do you live with? What are you studying? What activities do you do? And when you ask about drugs, you have to be a bit careful. You have to tell the patient that I would like to ask you a sensitive question which I ask all my patients of your age group. Is it okay with you? Okay, so this is something you have to tell because, see, talking about drugs, not every teenager will take drugs. So it's a sensitive question. The same applies when you're talking about sexual history. So when I ask about drugs or sexual history, I will tell the patient, John, I would like to ask you few personal questions or few sensitive questions which I ask all my patients of your age group. Is that okay with you? Okay, once you tell that, then the patient is aware that you're going to ask him something sensitive like about drugs or maybe sexuality, whether he's homosexual, whatever it is, so that's the scenario. Pre-frame the scenario, sensitize the patient that you're going to ask him something sensitive. Okay, so after that you ask about drugs, then S stands for sexuality, then last S stands for suicide or depression. So that's very important. So you need to rule out suicide and depression in this patient. Coming to management, good that one of the doctor has asked about blood sugar level, urine analysis for proteins, glucose, ketones, urine MCS, UECs, LFTs, FB, serum ketones. Very good. He's asked about HbA1c. See, of all these things, when a patient has come to you with compliance issues, the first and foremost thing the examiner is looking for is HbA1c. That's the main thing. You need to tell the examiner that I will order an HbA1c. Then you have to do baseline blood tests and urine tests, like all the tests that are mentioned there. And obviously, you have to admit this patient. And coming to the treatment, you need to involve the family here. With the consent of the patient, you need to tell the patient that I would like to involve the family and refer him to the endocrinology team. Referring to ophthalmologist, diabetic physician for checking complications, all these things are later things. But you are in the emergency department. This teenager has come to you with DKA, diabetic ketoacidosis. What are you doing now? Later referral to all those things that will happen for ophthalmologist, for podiatrist, all those things are not that important. They are looking at what are you doing now? When this patient has come to you, what is your approach? So I hope these points are helpful, and I will be doing more videos. If you have not yet joined the group, I hope you will join this group. because I'll be adding more videos in the next few weeks. And whenever I see a difficult scenario or a tricky scenario, I will try to do a video so that it will be helpful for everyone. If I look at the scenario which is based like a concept that you can study by referring some books, I will not be doing a video because I am a busy practitioner. So if I see something is tricky, I will surely do it. If I look at a question that says, can you please answer this? I can't answer every question, but something important like this, I will surely do a video. So make sure you search for 2015 AMC Clinical Study Group and join the group. If you have any important questions, leave a question there. If I think that is difficult one, or if I think that is something many students get trouble during the exam, I will do a video. I'm an examiner for few mock exams, so I know lots of things where students struggle. So I'll probably try to do more videos because this is one scenario many doctors will fail. So I used to write cases for AMC clinical mock exams. So I know a bit of the thinking pattern of the examiner. So I hope you guys will probably join the group, and probably I can help you with passing your clinical exam. I wish you all the best. Thank you.